We're going to start this Wednesday morning as we have for, I think it's now week 11 of this, and it's been fantastic 11 weeks. Dr. Shawn Feinstein from OrthoVirginia, sports medicine orthopedic surgeon, a team doctor in the area as well. Dr. Shawn, how are you doing on this Wednesday?
I'm doing well. Thank you so much for having me. I appreciate it.
Of course. Thank you for taking some time, carving some time out of your morning. I want to start here because you're a team doctor in the area, sports medicine orthopedic surgeon. So you bring kind of a different look into what we have had these last couple of weeks. How important is the role of team physician, and what exactly is that role?
Yeah. I might be a little bit biased, but I happen to think that the role of the team physician is really important. And I think that, athletes and athletic trainers and coaches would agree. The role of the sports medicine physician or team physician is varied and it is tailored to each team. And so we work very closely with athletic trainers to kind of be there when they need us and do the things that need to be done to keep all of the athletes healthy on the field and kind of ready to go at any time.
And how do you end up interacting with the athletes, trainers, coaches, everything throughout a practice week, and then maybe game day or even working them through an injury that they may have had?
Yeah, sure. We do most of our work with athletic trainers. Okay, so the athletic trainers, I give a ton of credit to them. They work incredibly hard, and they are kind of the first point of contact for these athletes. When they have any issues, they go to the athletic trainer. And when it needs to be escalated to the team doctor, that's when the athletic trainers and the athletes come to us. And so anybody who needs an evaluation, we'll do that during the week. We'll try to get people healthy during the week if they're rehabbing from an injury, whether it be minor or major. We want to make sure that they're on their own rehab program and preparing all week, especially for like football, to be doing what they need to be doing, progressing throughout the week to get back to that game day. We certainly do interact with coaches some, but again, our most interactions with athletic trainers and the important work that they do.
Dr. Shawn Feinstein from OrthoVirginia taking some time out of this Wednesday morning to chat with us. And I want to kind of take a look at NFL. And I know you're not working directly with the athletes in the NFL, anything like that, just providing your expertise. And yesterday we got the news that Travis Hunter underwent knee surgery to repair his LCL. I'm not going to pretend to say what LCL stands for. I just know there's an LCL, a PCL, and an ACL. But he got it all. He got it all figured out. There's no additional damage done, but he's going to miss the remainder of the season. And he decided not to have surgery the first couple of weeks through this injury. Then he decided to ultimately have surgery. Now he's out for the rest of the year. I'd love to get your expertise on this, of how important is it for a young athlete like Travis Hunter to end up going through this surgery rather than taking the non-surgical route and maybe being out longer but not having to go through surgery?
Yeah, I think there are a lot of things to consider when you're looking at these kind of injuries in these athletes, and there are many degrees of injury. So for him, it was the lateral collateral ligament, or the LCL. There can be strains or sprains of that ligament. There can be complete tears of that ligament. And it matters where it's torn. Some of these will heal in a brace. Some of these need to be surgically repaired. And so I think, he's a good example of, that surgery to repair a lateral collateral ligament is not done very commonly. It's a fairly unusual surgery to be done, mostly because the LCL is not typically injured in isolation. Now, of course, these things do happen, and I think it's important to kind of consider who the person is, what they're experiencing, what they're able to do, and then come up with a plan, whether it be surgical or non-surgical, to do the best thing for that person. And it seems like that's what they decided to do with Travis Hunter.
So we have an LCL, a PCL, and an ACL. Of those three, if I'm a fantasy manager, right, and I see one of those CLs pop up on the injury report, which one should I be most worried for?
Yeah, so the last one that you didn't mention is the MCL, and that's also a very commonly injured ligament. Those will be the big four in the knee. I think the ACL is probably the biggest deal, and the reason is because ACL injuries just don't heal very well on their own. Whereas PCL, MCL, LCL, again, it depends how they're injured and the demands that the athlete's putting on their knee, but those all have a fairly good potential to heal on their own, whereas the ACL just really doesn't. And that's why we do so much ACL surgery. That's why that's a big headline, out for the season with an ACL. There's just no good way at this point to manage those in a brace for these high-level athletes.
What have we seen in terms of growth in technology in practices to make it where when there is an ACL, a torn ACL, that they are able to then return? Maybe it's 9 months, 10 months, 11, however long it is. But when they end up returning, typically the athlete is 100%, if not 110%, almost back better than they were before. What have we seen in terms of advancements to get to where we are today?
Yeah, I think from a surgical perspective, things are pretty similar as they have been over the last 20 to 30 years. We're still doing what's called a reconstruction. We're not trying to stitch pieces back together, but we're taking out the old ACL, putting a new one in. And that's still the most reliable way to do that. Now, there are some techniques that are coming down the line where people are trying to repair the ACL or kind of have the body regenerate it with help. We're not quite there on those techniques yet, but I think what's come a long way is our understanding of ACL prevention and ACL rehabilitation. And so, we are getting people into physical therapy before their surgery. Okay, we know that, if they have full range of motion and good strength in their knee before surgery, they're going to be much better off after surgery. And then starting physical therapy and starting range of motion early, starting strengthening early. So I think we've come a long way in our techniques as far as physical therapy goes, and just getting people into rehab faster and getting things done more quickly, so that at that 9-month mark or whenever it is, whenever they're ready, they're back to full strength and their knee feels normal to them.
Dr. Shawn Feinstein, a sports medicine orthopedic surgeon with OrthoVirginia, taking some time out of his Wednesday morning. And I'd love to know game days. What does a game day look like for you? Or how involved are you with the athletic trainers in the actual game day atmosphere?
Yeah, so, especially with football, we are on the sidelines an hour before the game. We are evaluating players, that have issues that pop up during the week. We are getting people ready. We're doing last minute evaluations. And then, we always do what's called a medical timeout, where we meet the staff, the athletic training staff and the team doctors from the other team, come up with a good plan for them, whether we're the home or away team. We need to make sure that everybody's on the same page in treating these athletes and how to get them the most efficient, the best care that they can during that game. And so a lot of the kind of things that we do on a regular basis are, last minute evaluations to make sure everybody's as good as they can be. And then just planning to make sure that if something comes up during the game, that you're ready and everybody's prepared.
So say something comes up in the game, an athlete gets injured. What's the process then afterwards if it is a serious injury that requires surgery?
Yeah. So I think, the first thing that our first job is the on-field evaluation. Okay. When an athlete goes down, the first thing you have to figure out, is this something that's going to keep them on the turf or on the field, or can we get them off of the field to the sideline and do our evaluation? Obviously, with head injuries, spine injuries, those are the types of things where you really don't want to move that athlete until they are stabilized. And so that's where we'll bring the spine board in and EMS comes. There's some, kind of fractures where they can't really limp off the field. And so we need to stabilize that fracture on the field, get EMS to bring a cart out and get them, right into the ambulance. Assuming they are able to get off the field with a little bit of help or by themselves, then we bring them off to the sideline, and that's where you see us duck into that little pop-up tent, that everybody wonders what goes on in there. It's really not very glamorous. Ours don't have a lot of technology in them. It's just a single, exam table. And we, have them hop up on the table and we do our, a little bit more of a thorough evaluation like we would in the office. And a lot of the decision making is, how serious is this injury? Is this something that's, that they need to go to the hospital today? Should they go get an X-ray the next day? Should they go back into play? And so those are the decisions that we're making in real time, just trying to take in as much information as we can and talking with the athlete and say, is this something that should keep them out? Is this something that they can go back in and get right back out there? And we've seen every variety of that, just being on the sideline.
You said that there's, in the blue tent, the scary blue tent that is what we hear on the broadcast, but you said it's just an exam table, nothing too glamorous, just like it's in the office. It's got to feel a little different. You've got to feel the game day atmosphere kind of just radiating in through what I imagine is very thin blue tarp.
Yeah, absolutely. But, I will say, it's louder than my typical exam, room, for sure. But when you're in that tent, you're locked in. It's just you, the athletic trainer and the athlete, and you're just listening to what they're saying and doing the best evaluation that you can do, without, having an X-ray machine in there or any technology in there. So it's just kind of a way to kind of isolate yourself, separate yourself from what's going on the field, and allow you to get a more thorough evaluation to see, okay, do we need to go into the locker room and get an x-ray, or can they go out, ride the bike and try to get back in?
Dr. Shawn Feinstein from OrthoVirginia taking some time out of his morning to chat with us. And we've talked a lot about athletes, everything like that. Outside of working with athletes, do you treat and work with regular Joes too?
Absolutely. The vast majority of my patients are not professional or semi-professional or collegiate level athletes. My specialty is sports medicine, but it's really fully involved in shoulder and knee surgery. And I treat patients of all ages, whether they would consider themselves athletes or not. And there are some people that, aren't playing sports, but they, like to stay active. And so, what I do is all about, helping with pain, restoring function, and allowing people to get back to whatever it is they want to do, whether that's, playing football every Saturday or, whether that's being able to, mow the lawn and put away groceries.
That's awesome. And where can people go to schedule an appointment if something hurts, if they need surgery, anything like that with you guys?
Yeah. OrthoVirginia.com that, we have offices all over the area. So we'll have someone in your area of expertise that's close to you. You can make an appointment there. You can also call our appointment line, and our folks will get you to the right place with the right people.
Awesome. Dr. Shawn Feinstein, thank you so much for taking some time out of your morning. Have a great rest of your Wednesday.
All right. Thank you. You too.